Today is a World Mental Health Day. When we talk about mental health related issues, what comes to mind? The media has always and often portrayed depression as a rich man's disease. Mental health related issues are discussed in the context of the biographies of rich and famous celebrities and Hollywood and Bollywood actors who have battled the disorder. But did you know that the conditions of many mental health hospitals in India's towns and villages are pathetic? Even today, the poor are chained. They are tied to their beds in mental hospitals. They are forcefully administered shock treatments. They are assaulted, locked in rooms, and brutalised. Many of our country's poor don't have a recourse when they have a mental health issue because our government doesn't spend enough on mental health services. And this is not just India's problem. Let's unbreak this news. In June this year, Pavlov Hospital in Kolkata, one of the prominent mental hospitals in West Bengal, was served a show cause notice by the West Bengal State Health Department for gross negligence. During an inspection, it was found that at least 13 female inmates were locked inside 2 rooms in the hospital. A news report quotes, "The rooms were dark, shabby, dirty, with broken iron cords strewn across the floor, thereby exposing the inmates to the risk of being injured by the rusted, sharp, and broken ends of the iron cords." The hospital superintendent came much later and could not provide any logic to the inhuman lodgement of those inmates. On inquiry, the on-duty nursing staff said that they were housed there on the advice of the psychiatrist on the ground of their violent behavior, but they failed to produce any written advice to that effect. The inspection report stated that even the utensils used for serving food were not cleaned. But this is not just the story of one hospital in India. Here's a report that was filed by a news organization that investigated what it's like to be deemed a woman with mental health illness in Maharashtra. In this report, the staff of a mental health care center can be seen admitting that ECT, which is the electroconvulsive therapy, also known as electroshock therapy, is given to most female patients.
There have been reports across India's mental wards of negligent and even improper care, including rounds of electroconvulsive therapy, or ECT, often forced and without consent.
This one female ECT room is there. Routinely, we are giving this ECT. हर रोज तो 25 तो रहते हैं patients. Most of the mental illness ECT is required.
ECT is primarily prescribed as a last resort and in the most difficult to treat cases. The procedure involves a series of electric shocks to the brain to induce seizures and can have severe side effects, including long-term memory loss.
How about this mattress on the floor? What's this for?
So we are keeping the patients after the ECT here, na?
So there are patients lying down over here
lying
as
down on
patients
this. After
are
that,
getting...
after they get consciousness here, respiration.
In 2019, the media reported a shocking story from Uttar Pradesh, where thousands of mentally ill people were found to be chained like cattle for years in a shed in the state. The report states that people with psychological disorders were shackled like cattle, their feet tied with iron chains and padlocked for days, months, and years in UP's Badaयूं. In many places in India, poor mental health patients are heartlessly abandoned by family members and relatives. In Maharashtra alone, a report suggested, as per data from January 2016 to September 2021 procured by the Indian Express, a total of 5,877 patients with mental ailments have been abandoned by their relatives in the 4 regional mental hospitals, Pune, Thane, Raigad, and Nagpur. This is just the state of affairs in 4 regional mental hospitals in one state. According to reports, India is one of the countries with the highest number of depressed people in the world. World over, in third world countries, millions of poor people are ill-treated in mental health hospitals. As per global statistics, 1 in 8 of us is affected by mental health issues. Data suggests that COVID-19 pandemic alone has caused a 25% increase in the prevalence of depression and anxiety across the world. But unfortunately, governments across nations are not spending enough to tackle the mental health crisis. A press statement released by the World Health Organization this year states, WHO's most recent mental health atlas showed that in 2020, governments worldwide spent on average just over 2% of their health budgets on mental health, and many low-income countries reported having fewer than 1 mental health worker per 100,000 people. Depression is a difficult conversation. It gets even more complicated if it's about mental health related issues amongst the poor. Mental health issues are deep wounds that never show on the body, but cut deeper and are more hurtful than anything that bleeds. Millions of us need help. The ones who are suffering the most are underprivileged people. This scenario will only change when governments recognize that mental health issues are a major public health concern. The widening gap between the haves and the have-nots when it comes to access to healthcare must be bridged, because mental health care is not a luxury or privilege of a selected few. It is a fundamental human right of every individual.